This is Mrs. Case, our patient. She's currently 31 weeks gestation with her first child. She was admitted to the hospital last evening to rule out preterm labor as well as abdominal discomfort. Her sister's been at her bedside extremely concerned about her health as well as for the baby. Caitlin has been Mrs. Case's afternoon shift nurse, who's now preparing to give report. Megan, the oncoming day shift nurse, as well as Shai, our Oakland University nursing student, are preparing to receive report. Let's listen in to the shift-to-shift report at the patient's bedside.
Hello. Hello. All right, well, this is your new nurse, Megan. She's going to be your day shift nurse till about 7 o'clock tonight.
Hi, Mrs. Case. I'm Megan, and this is Shai. She's a student nurse from Oakland University, and she's going to be working with me today to take care of you.
Okay, well, this is Mrs. Brown. Oh, you know, I mean Mrs. Case. Sorry.
Can I check ID band really quickly? My instructor taught us to check ID bands as soon as we get into the patient's room. Yes, this is Mrs. Case.
I know, I said it was Mrs. Case. I mean, I know my own patient. She was Mrs. Case last night, and she is still Mrs. Case this morning. I mean, why would you check the wristband anyway?
Well, checking ID band is part of patient safety, right?
That's right, Shai. Caitlin, what were Mrs. Case's assessment findings last night?
You know, she came in with hypertension and abdominal pain.
Hypertension? I have hypertension? Oh, what does that mean? Is my baby
oh,
going to
wait.
be okay?
You know what? I do think this is Mrs. Brown.
Really? Are you kidding me? You don't even know what patient you're talking about. How can you take care of my sister when you don't even know what you're talking about? This is ridiculous.
I'm so sorry. Caitlin, do you need a second to get yourself together?
No, really, I'm fine. Really, I got it. You know, this is just ridiculous. It's taking way too long. I have so much things to do when I get home, and I have to be back tonight for another shift.
Okay, Caitlin, let's get back on track here. What did Mrs. Case come in with last night?
She came in this night thinking she was in labor. I know they're just Braxton Hicks. I mean, you know how it is. In my opinion, they should just dealt with her in triage and then sent her home last night. But really, I don't know why she's still here.
Okay, but what were Mrs. Case's assessment findings? Were there any labs to be done today? Were there any tests that she was going for today?
You know, she had some labs drawn last night. However, I have not had time to look at the labs because I've been way too busy. You know, bed A had me happen all night, and then bed A and C ended up delivering. And so I was actually dealing with the patients and families that were actually in true labor.
Why don't we check the EMR for Mrs. Case? Won't that have the most up-to-date information regarding tests and labs results?
That's a great idea, Shai. We can go ahead and check the EMR database to look at the laboratory data, and then we can also go ahead and look up a clinical pathway to see if there's an intervention that we can do with Mrs. Case to alleviate some of her pain.
Okay, well, you two do that. I'm going to get my personal belongings, so this is just taking way too long, and I need to get out of here.
Wait, Caitlin. I still need to find out the assessment findings on Mrs. Case. I need to know what her pain was like last night. I need to know what her pain was like when she came in, and I need to know your recommendation for a plan of care.
I told you, Braxton Hicks, okay? She came in complaining of contractions, and that explains her abdominal pain.
Okay, but how did the patient describe the pain last night when she was admitted? I need more detail. Caitlin, I feel like we're not communicating effectively right now, and we need to work as a team. I need to know what you know in order to plan the best care for our patient.
I'm really in a lot of pain over here. Do you think maybe you could help me and just make it stop? I just want my baby to be okay.
Seriously, what are we even doing here if you guys aren't going to help her? I told you we should have went to Beaumont.
Mrs. Case, how about we do some relaxation techniques with you until Shai and I can get into your electronic medical records and figure out what's going on here, okay?
Okay.
That's a great idea.
Okay.
I just read an evidence-based paper on deep breathing techniques and relieving pain. I'll help Mrs. Case.
That'd be great.
Good.
Knock, knock. Good morning, everyone.
It's gonna be okay, huh?
Good morning, Mrs. Case. I'm Dr. Webb.
Hi.
I know you were admitted last evening for some preterm labor and some abdominal discomfort. How are you feeling this morning?
Nothing's really changed. It's still pretty much the same. And this nurse over here hasn't helped me at all night.
My goodness, Mrs. Case, I'm so sorry to hear that. Tell you what, I'm going to get with the nursing staff, and we'll come together and come up with a better plan of care for you to make sure we address your pain.
Okay.
How does that sound?
That sounds good.
Okay. Ladies, can I just see you for a moment outside the room here?
It's going to be okay.
Yes. Okay, we were all in the room with Mrs. Case, and obviously we heard her concerns about her quality of care, and she's still having some abdominal discomfort. And I have to admit that I have some concerns also. I went to access Mrs. Case's electronic medical record this morning and noticed there was a lack of information, no assessment data, no progress notes, and makes it very, very difficult for me as a physician to treat Mrs. Case. Caitlin, exactly what happened here? How come nothing was entered in Mrs. Case's electronic medical record?